Hi, welcome back. This is Future Doc, the TV show. I'm Dr. James Biddle. We're doing an educational lecture series on medical topics viewed from the perspective of integrative medicine. Tonight we're going to talk about cardiovascular disease. I've got a lot of information to go over. I'm very excited about this, partially because cardiovascular disease is one of the #1 killers in the world, and especially in the United States, and partially because I teach this to other doctors twice a year nationally, so I know this topic very well, and I'm excited to share it with you. And then the last part of it is because we get great results with patients. There's a lot you can do for people to help them with cardiovascular disease that does not necessarily involve surgery or medications. So we're going to go right into it. The disclaimer to this is we're not trying to treat anybody here. You should be treated by your own physician. There's an error on this slide. It's actually 12 million vascular deaths in the United States each year. It's the #1 cause of death in both men and women overall. Still, all the breast cancer and prostate cancer, although they may scare you more, actually pale in comparison to the numbers of people who actually die compared to heart disease. So how do we treat cardiovascular disease in conventional medicine? Well, we bypass the arteries. If you have a blocked artery feeding the muscle to your heart, that causes a heart attack. So what conventional medicine does is a coronary artery bypass graft, or CABG. And they actually open up your chest, and they sew an artery from your chest, or a vein from your leg, around the other artery. What are the challenges with that? Well, one, it's very invasive. You have your chest cracked open. It's very expensive. It's anywhere from $35,000 to $60,000 for a surgery like that. Number 3, it's relatively dangerous. You have a certain amount of risk of dying on the table or having delayed brain damage from that. And lastly, it only treats those arteries. If you're having blockage of the arteries in your chest to your heart, you're also having blockage of the arteries throughout your body, to your brain, to your legs, to your pelvis, and you're going to have problems there also. And that bypass graft doesn't do anything for that at all. The last problem is that this procedure is overutilized. Here's evidence right here from Harvard cardiologists published in the Journal of the American Medical Association, showing that 75 to 80% of bypass surgeries are medically unnecessary when judged by the criteria of the American Heart Association. So judged by their own criteria, if you get a second opinion before operating on these people, 3/4 of them would not have those surgeries and should not have them. What causes heart disease? It's universally accepted now in medicine that cardiovascular disease is an inflammatory disorder. All the different risk factors that deal with cardiovascular disease add up to increased inflammation in your blood vessels, walls, and in your bloodstream. And that increased inflammation causes increased viscosity or thickness of your blood, and then increased cholesterol plaquing on the wall of your artery. And that's the underlying cause of all that, and that usually starts with damage to the inside lining of the artery called the intima, or the intimal wall. The 4 classic risk factors, which are thought to account for about 75% of heart disease, or at least 75% of people who have heart disease have at least one of these risk factors, are elevated cholesterol, hyperlipidemia, hypertension, diabetes, and smoking. So I'm not going to talk a whole lot about those because those are not the things that you're here to learn about. Those are the things that conventional medicine already knows about. I'm here to teach you about the things that conventional medicine is not paying enough attention to. Things that have very good science behind them but are not yet being used by conventional doctors in their knowledge. So next we have emerging or novel risk factors for heart disease. These include C-reactive protein, lipoprotein A, fibrinogen, and homocysteine. Now I'm going to talk about some lab abnormalities that we can measure right away to see if you have an increased risk for cardiovascular disease. The first one is a genetic component called Lp(a), or lipoprotein A. This is present, according to the Cleveland Clinic Journal of Medicine, in about 1/4 of the American population. It's a bad cousin of LDL, bad cholesterol. It's actually a redundant gene. This gene is supposed to make one molecule, but it's gotten elongated in some families and makes a different molecule. That protein then wraps around cholesterol and makes it more sticky. We can measure this, but most doctors don't. Why don't they? Because the conventional statin drugs for cholesterol don't treat this. So all those drugs that are the major sellers for treating heart disease don't do anything for Lp(a), which is the major cause of heart disease for the fourth of the people with heart disease. You have to make the treatment inexpensive, safe, non-toxic, and easy to do. And we can do that with niacin, vitamin C, CoQ10, and lysine and proline. The next lab marker that everybody with a family history or a personal worry about heart disease should have is called homocysteine. Homocysteine is an amino acid that we all have, but some people get too much of it. When you get too much of it, it acts like a scrub brush and roughs up the inside of your artery wall, and then the cholesterol lays down and forms a plaque there. Why do you get too much of it? The number one cause in the United States for having too much homocysteine is a mild B12 deficiency. In fact, so mild that normal lab tests don't show it. Your B12 levels can be normal most of the time, but yet your homocysteine can come down with B12 therapy. You can also lower homocysteine by giving folic acid, by giving B6, and by giving betaine, which is another B vitamin. But B12 is the best because B12 deficiency is the number one cause of elevated homocysteine in the United States, unless it's genetic or kidney disease. We measure inflammation with a lab test called a CRP, or a C-reactive protein. This measures the subtle inflammation that's in the bloodstream. It also, besides reflecting inflammation, it's causing damage itself. It actually induces something called adhesion molecules. It upregulates these adhesion molecules on the endothelial cells, or the inside lining of the blood vessels. And by doing that, it attracts the monocytes, or white blood cells, and activates this coagulation pathway. When you have an elevated CRP, what do? Well, guess what? There are no protocols in medicine that I could find that says how to react to this, so I made up my own.
You're watching Future Doc with Dr. Biddle.
What are the foods that we can eat that can decrease our risk of heart disease? Well, in our sustainable nutrition lecture, we went over all the strategies of balancing out your proteins, fats, and carbohydrates. Which are the best types of fats? Which are the best types of carbohydrates? I don't have time to review that here today, but I'm going to go over some very specific foods that you can eat, and we can plan out a menu for our next party, our heart-healthy party. The first is nuts. I consider nuts our God-given perfect snack. They're prepackaged, ready to go, don't go rancid very easily, and they have all the stuff you need. They have fiber, they have minerals, they have magnesium, zinc, selenium. They decrease your risk of cancer, and they're one of the strongest foods for decreasing your risk of heart disease. If you eat nuts 3 or 4 times a week, you cut your risk of heart disease in half. What else to eat with those nuts? Well, how about some fish? If you eat fish at least once a week, you can decrease your risk of heart disease, sudden death from heart disease. And this is also looking at doctors, over 20,000 men for 11 years, and the relative risk of dying from heart disease, 0.48, meaning only 48% risk of dying from heart disease compared to those who don't eat fish at all. There is no prescription medication that can give you statistics like this. There's all the statin drugs maybe decrease your risk of heart attack by 2, 3, 5%. You have to treat like 50 people for 10 years to save 2 lives with these prescription medications. No statistics like this at all. But because the medical journals that doctors learn from are run on the advertising dollars from drug companies, that's what becomes the standard of care, is to give everybody these medications rather than simply changing their diet. And that's what needs to change in America. One of the many things, obviously.
You're watching Heart Health Alternatives with Dr. Biddle. You've seen Part 1. Now check out Part 2.